Hi everyone, I am Dr. Suraj Chiraniya, hematologist and BMT physician in Mumbai. Today we will discuss what is follicular lymphoma. Follicular lymphoma is one type of blood cancer which arises from a cells called as lymphocytes. These are one type of white blood cells. Usually these cells are important to prevent a body from the various infection. This cancer mostly arises from the lymph node and other lymphoid tissues inside our body. What are the causes and risk factors for follicular lymphoma? Usually there are not known risk factors and causative agents for follicular lymphoma, but usually this is a disease of elderly population. So first risk factor is age. If patients are usually more than for 60 years of age. Second, men having a more chances of having this cancer compared to females. Third, immunodeficiency problems. If the patient suffering from some autoimmune or immunodeficiency problem, chances of this lymphoma is higher. And fourth, causative agents are if the family members having a history of lymphoma, especially first degree, then the first degree relatives has a more chances of developing this lymphoma. What are the symptoms of follicular lymphoma? Usually follicular lymphoma patients can be asymptomatic. There can be only swelling over the neck area, armpit or groin area, or there can be lump in the abdomen. Second, fever, that is persistence and low grade coming every day. Third, fatigue. Patient feels unusually fatigued even after taking sufficient rest. Fourth is weight loss, unintentional weight loss more than 10%. Fifth is night sweats. The patient having sweating mostly in the nights is one of the symptoms of this follicular lymphoma. Coming to next point, how you will diagnose a follicular lymphoma. First, on physical examination, there are the lymph nodes in armpit, groin, and cervical area, means neck area. Second, blood test. Blood test usually we do to look after the overall health of the patients, and renal kidney function test. Third, most important is imaging. In imaging, usually we do the whole body PET scan to assess the areas where this follicular lymph node has affected the lymph node area, and to know their uptake and involvement. Fourth, after doing PET scan, the area where the highest uptake is seen, we do a biopsy. That can be excisional or core biopsy to know to confirm the diagnosis of the follicular lymphoma. Fifth is bone marrow aspiration and biopsy to see whether the bone marrow is involved or not. Fifth part of the follicular lymphoma, the treatment. The treatment mainly depends on the symptom stage and the staging of the disease. Usually in most cases, when patient is asymptomatic, only physical findings are present. Then observation and watchful expectancy is a standard of care. Second, if the patient having symptoms and stage 4 diseases that causes a problem like effusions and B symptoms like fever, weight loss, we need to start the treatment. The treatment modalities are chemoimmunotherapy, means chemotherapy combined with the immunotherapy. Second, immunotherapy alone, the drugs like rituximab and Gazyva that specifically acts on the CD20 positive cancerous cells is one part of treatment. Third is targeted treatment, the medicines that acts where the cancer pathways are affected and that increases the survival of these cancer cells can be targeted by giving this medicine called a targeted medicine. Fourth, in recurrent or high risk cases, we can offer the autologous stem cell transplant. So friends, if we consider follicular lymphoma, it's a chronic problem that have a very effective treatment options are available. Mostly patients with follicular lymphoma lives for years, so special attention can to be given to minimize the side effect of the treatment, give the appropriate diet and the exercise schedule. So we conclude follicular lymphoma by saying it's a slow growing very treatable cancer. People live for years with these lymphomas. So the starting of treatment is very important at a crucial junctions, and advances in the treatment has increased the lives of many people. So for personalized treatment, please visit your nearest hemato oncologist. Thank you. Till next, stay updated, stay tuned.